Hello, and thank you for reviewing this presentation. The contents of this presentation are imperative to the student counselor who seeks to understand each field of counseling, the requirements for each type of counselor or therapist, and historical information relative to each independent field of study will be captured throughout the contents of this PowerPoint presentation. You will have the opportunity to see 4 student counselors from 2 different time zones present the material related to counseling fields. The student counselor group consisted of a collaborative effort from Courtney Bussman, Ashley Gonzalez, who are both Mountain Standard Time Zone students. The other 2 collaborating group members are Tammy Mott and myself, Nikia Collins, from the Central Standard Time Zone. This collaborative effort started in Season 2 of the Counseling Services and Methods course, which is instructed by Dr. Celine Phillip. It is our goal to introduce to you 4 fields of counseling, along with an interview of a licensed marriage and family therapist. Group member Ashley Gonzalez conducted the interview with Dr. Holcomb, and it's our selection of the licensed marriage and family therapists that we'd like to discuss a little bit more in depth today. This decision was unanimous to work with a licensed marriage and family therapist, and we felt that this would be the best area of focus for our group. Although our interview with Dr. Holcomb, which is a licensed marriage and family therapist, is an integral part of this presentation, we took an equal look at 3 other types of counselors or therapists as well. The following are the types of counselors and therapists that we'll review in the presentation: the LMFT, the professional counselor, the clinical social worker, and lastly, the clinical psychologist. The group met via Zoom on 2 separate occasions. Our first Zoom session was to organize and set timelines and deadlines. We also prepared open-ended questions to present to the therapist. And the second Zoom session was a project overview to discuss the next steps in the project and which direction the presentation would go. We remained in contact with each other each week via email, text, and phone to ensure that the presentation would be moving in the most appropriate direction. Lastly, the items that our group captured alongside each field of mental health included educational requirements throughout the terminal degree, the professional history and development of each field, and lastly, professional organizations, memberships, and codes of ethics. At this time, Ashley Gonzalez will now present to you the counseling interview that we conducted with our LMFT, Dr. Holcomb. Thank you. Enjoy the presentation.
Thank you, Nikia. As Nikia mentioned, I am Ashley Gonzalez, and I had the opportunity to interview Dr. Jennifer Holcomb, co-owner of Positive Outcomes, LLC, a private practice in Colorado Springs, Colorado. She is a licensed professional counselor, licensed marriage and family therapist, and a board-certified behavior analyst. Our interview focused on her experiences specifically as an LMFT. The slide here and the following slides indicate each of the 10 questions I presented to Dr. Holcomb, broken into 5 categories: education, therapy-specific, social issues, legislature, and personal. For the educational questions, Dr. Holcomb indicated that she received her education in Texas and has seen a difference between LMFT programs in Texas versus those in Colorado where she practices. She stated that an area that increased her own understanding and should thus be included in more Colorado and in other state programs is neuroscience or neurobiology. She also emphasized the importance of choosing programs and internships that explore a variety of mental health issues and that have exposure to different therapeutic modalities. She encouraged working with multiple supervisors and at multiple sites in order to gain diverse experience. This diverse experience will be helpful when encountering clients from different age groups, different backgrounds, and even clients who may have comorbid disorders or other medical conditions. Moving on to the therapy-specific questions, Dr. Holcomb's personal theoretical orientation is interpersonal neurobiology, which focuses both on the individual and on how his or her relationships affect perceptions. She agreed that there are other theories that are also effective, but that it is most important for a counselor to choose an orientation that they will become competent in. It is also important to have an understanding of different theories in order to adapt to the needs of a client. In addressing divorce in therapy, Dr. Holcomb explained that divorce issues are not necessarily a trauma to clients, but rather a process of grieving. It is important as a counselor to help a family maintain communication and move through this process in a healthy manner. Dr. Holcomb also stressed that in family therapy, the client is a whole family, not just an individual, and that it is important to give every member of the family equal time to express their needs and feelings. However, if one individual is struggling, it may be beneficial to refer out to individual therapy. In answering the social issues questions, Dr. Holcomb expressed the need to treat all clients equally, including homosexual couples. She recommended the book Permanent Partners: Building Gay and Lesbian Relationships That Last by Betty Berzun as a resource for counselors to educate themselves on issues that homosexual couples may face. Dr. Holcomb indicated that in situations where one person could be completely for a divorce, while the other may not, it is important to remember that divorce is sometimes the only healthy option for a couple, and the focus again becomes helping each person through this grieving process. The legislative question was not applicable to Dr. Holcomb because she does not accept Medicare clients, as Medicare currently only recognizes licenses in social work and psychology. However, if expanded to include LMFT services, more clients will have access to therapy. Personally, Dr. Holcomb loves her work as an LMFT because she is able to help others recognize that their struggles do not define them. Her orientation of neuroscience guides her to educate clients about neuroplasticity, that in turn offers clients the concept of change. Watching this change in others is what Dr. Holcomb finds most fulfilling in her field of work. This concludes the interview with Dr. Holcomb, and now Tammy will review the educational requirements, professional history, and the professional organizations and ethics that guide the marriage and family therapy field.
Thank you, Ashley, for being an integral part of an excellent interview with Dr. Holcomb. And as Dr. Holcomb indicated, state requirements differ when it comes to education and licensing for the prospective counselor. So it is very important for each student to become very familiar with the requirements in the state in which they reside or the state in which they desire to practice. To become a marriage and family therapist, education requirements are that one either obtain a master's or doctoral level degree. Their field of study can be marriage and family therapy, psychology, social work, or psychiatric. But the institution must be approved by the accreditation committee, and it must be a regionally accepted institution. 45 semester hours are required, with 9 additional hours in either human development, marriage and family studies, or marriage and family therapy. In Colorado, the exam is administered by the accreditation committee for the marriage and family therapist, and it is a computerized exam. Once the student has passed the exam, they enter into postmaster's requirements. 2,000 credit hours are, 2,000 accrued hours are required, with 1,500 of those hours being face-to-face, and 1,000 hours being in the field. Supervision is also required in the postmaster's training. 50 hours of supervision are required, with at least 25 of those hours being face-to-face. There are professional memberships and organizations which are designed to support the counselor and the counselor in training. Organizations offer support for career development, networking, advocacy support, job placement, and even legal liability issues. For memberships, a membership fee is usually required, but enrollment is open to the grad student, the master's in counseling, the psychiatry student, and the social worker. In 2012, a code of ethics was established for the licensed marriage and family therapist. The AAMFT, the American Association of Marriage and Family Therapists, established the ethical code, and they are also the ones responsible for the standards and the enforcement of the code. And thank you for your time. And now, Courtney will present the summary of professional organizations along with references.
Thanks, Tammy. The world of marriage and family therapy is unique in its own right, and it is helpful to look at other types of mental health therapies to highlight that. Marriage and family therapy started much later on than other counseling disciplines, decades after professional counselors, hundreds of years after clinical social workers, and centuries after clinical psychologists, as this niche of counseling established itself around the early 1950s. The beginning of marriage and family therapy started out with the evolving need for it on the field, largely due to events like the Whole House in Chicago, which is connected to social work. Clinical psychology very much began with Greek philosophers and their attempt to understand the whole person. Professional counseling started to take shape with discoveries like PTSD between 1900 and 1950. Social work finds its traces back to the 1500s in England when the Elizabethan Poor Law gave the Church of England the funds and the ability to oversee the poor. In terms of education, all these disciplines require the minimum base of a bachelor's degree. For social workers, it is highly recommended to get a master's degree since jobs are few with a bachelor's. The most important element in social work programs is that it is accredited by the Council on Social Work Education. Psychologist education has to happen at the graduate level, and while some get a master's, most psychologists obtain a doctorate degree. The American Psychological Association, also known as the APA, is in charge of accrediting psychologist programs. The typical length of this post-college education is 5 to 7 years. Professional counselors have to get a master's degree in order to achieve licensure, while there is the option to get a doctorate. These programs are accredited by CACREP, the Council for Accreditation on Counseling and Related Educational Programs. This is all compared to marriage and family therapy, which has its master's programs around 45 credit hours, the least of these disciplines, but arguably with the most specified supervision work after graduation. The professional organizations for all these disciplines are individual to each field, but they do all overlap, with each one having its own national work associations. For professional counselors, the American Counseling Association proves to be the main professional organization. However, there's also the National Board for Certified Counselors, as well as Chi Sigma Iota, which is by invitation only. Clinical social workers can take part in numerous organizations, the main ones being the National Association of Social Workers and the Clinical Social Work Association, with also there being many specified organizations for the clinical social work subfields. Clinical psychologists have quite a few associations as well, but the main ones are the American Psychological Association, the American Academy of Clinical Psychology, and the American Board of Professional Psychology. The marriage and family therapy field, interestingly, has a more limited amount of associations than some of the other disciplines, but they do have the American Association for Marriage and Family Therapists, the International Association of Marriage and Family Counselors, the National Council on Family Relations, and the International Family Therapy Association. However, the overall less amount of associations could be largely due to its being the newest field out of all these disciplines. All in all, while there are a lot of overlaps and comparisons with marriage and family therapy in relation to professional counselors, clinical social workers, and clinical psychologists, it stands out on its own powerful, distinct purpose.